So this morning we're going to go over how to remove your dressing after an otoplasty. It's really mechanically quite simple, but we're going to show you how to take the dressing down, how to clean the ears, so you can do this at home. Typically it's done about the second or third day after the operation. So during the surgery we put on this special kind of elastic netting. You can just take any sort of basic scissor at home. This is a more fancy medical one, but your standard kind of desktop scissor would work just fine. And just begin to kind of snip through the webbing, and as you make a complete cut through, it really begins to release pretty darn easily like that. And now you can just gently kind of pull the rest off. One thing about after an otoplasty, it's not so much that what we're doing today is that mechanically tricky, it's just knowing kind of what to expect. So you're going to have all these gauzes around the ear. They're going to be a little plasters on there. So just remove them very carefully. And you're going to see a lot of old, yucky, dried blood in there. Don't let that startle you or bother you in any way. And then you're going to see the ear. So it's a little, we still have the marks on the ear from the surgery. That's pretty typical. I don't like to rub those off because I think it's a little bit harsh on the skin. So we've got the marks on the ear. The ear is just a little red. Looks a little, I call it doughy or spongy, but you can see how the skin just looks a little thicker than it would normally, and that's just because obviously the skin of the entire ear is kind of swollen and puffy. It's going to take a little time for that just to kind of leave the skin. Now if we look from behind, it looks pretty clean back there. Now you could see more dry blood than that, and that'd still be totally normal, but there's very little on this one, so that's a good thing. But if there is some, then we're just gonna, what we're gonna have here that work? There you go. So now, which ear stings, sweetie? Was it this one? Okay. So now we'll try and get in there kind of tight with our video camera. Looks pretty good. The distance from the scalp really looks pretty good. Some of this old color here, that's the betadine that was just placed on the skin when we did the operation. And these marks are marks that were used just to accurately do the surgery. I tend to not rub them off because it's kind of, you have to rub really hard on the skin, and they're going to come off in the next day or so just naturally by cleaning the ear. So let me just show you now how to clean the ear. We'll do it really gently. And then I think when we get a little ointment on there, it'll feel better. So now we're just using, this is just a little tiny medical cup with some hydrogen peroxide in it and some standard Q-tips. These wooden ones are hard to find. You'll probably use the standard kind of the Johnson & Johnson kind of Q-tip. And then just kind of get in those little nooks and crannies a little bit. You don't have to be too aggressive. And just with that little bit of Q-tip dipped in hydrogen peroxide, just kind of clean off the edges of the skin. You don't need to overdo it if it's a little uncomfortable. Just a little cleaning is fine. Part of the post-op care of an otoplasty patient is you can shampoo your hair after the operation. So if the cleaning with the Q-tips is a little tender, just next time you shower, just get a really good lather going, and you can kind of get back in the grooves with your pinkies. Moms can do it, moms or dads can do it for their kids. If you're an older patient, obviously just use your own fingers to get back in that groove. But just try and keep it kind of clean back here. So that was the cleaning step. And now I'm just going to take, these are dry Q-tips, there's nothing on them. And we're just going to kind of dry behind that ear. Sorry. No need to overdo it. So if it hurts, don't do it. There's no reason to do something to the point of pain. So just clean it up a little bit. And the last thing we do, hopefully, is more soothing than painful. But we're going to take some of the antibiotic ointment. And now we have these packets. You'll probably have a tube of it from the drugstore. This is the bacitracin. And we'll just take a nice little amount of that. I always say it's about the size of a green pea or a large kernel of corn. And then just kind of gently, we're just very gently, just kind of put it back behind the ear. And this usually feels kind of good because the ointment's a little cool. And just kind of put a thin layer back there. Again, there's no need to force anything. There's no need to do anything that's too uncomfortable. Just do it gently. And again, don't forget that part of the post-op cleaning process is when you do shampoo the hair, you can get back there with some sudsy soap, and that will also kind of help clean things up a little bit. Let's have you turn back towards the camera this way, sweetie. Let's just look at this ear now, just because it's towards the camera. So all the things that can be very normal after an otoplasty, that's just old, dried betadine. See how the skin here almost looks, I call it spongy or doughy. That's so super normal. We see that in probably 90% more of ear pinnings. The skin looks very swollen, congested. I call it doughy or spongy. Totally normal. I'm going to clean that up just a little bit here so we have that on video. So again, I'm going to take these Q-tips, I'm going to dip them in the hydrogen peroxide. I'm going to be gentle. You don't have to do this to the point of discomfort. And just get in there and just kind of clean a little bit. And the thing about cleaning, for the moms and dads watching this video or the older patients, you don't have to get it all today. You know, you can clean it a little bit each time over the next 2 or 3 days. It doesn't have to be perfect today. We just want to get, every time we clean it, we get a little bit more stuff off of there. A lot of what we're seeing is just that orange color from betadine, and we do kind of like to leave that on there just during the surgery. The reason it's still on the skin is just because it is antibacterial, so it's kind of there to prevent infection. But now that it's been a couple days and the dressing's come off, we can begin to kind of clean that off. So again, don't do it to the point. No one needs to, this doesn't need to hurt. It can all be very gentle, but we'll just get kind of that much off for today. And then we know that we can clean it maybe 2 to 3 times a day for the first couple days, and it'll require less cleaning as time goes on. So we'll kind of stop there, no reason to make it painful. And I'm just going to take a little more of that ointment. Just a nice little blob there, just to see that amount. Just going to gently put it behind the ear. Doesn't need to be that aggressive, just kind of where it naturally kind of goes. And we'll leave it at that. Don't make it painful. This is just a basic little headband. It's not the fanciest one, it's just the ones that we have in our office. Some kids like their parents to get a cool one from the local sporting goods store. But then you just take the headband, go over the top of the head, just so it's protecting those ears a little bit. And that should fit pretty comfortably. You just want to protect maybe the upper half of the ear. The blue ink from surgery, that's going to come off in the next few days. Just as the skin oils and everything, that's just going to fade. If it really bugs you, you can just get a little bit of soap and water with a Q-tip and get that off of there. But that's basically how you want to dress your ear after the otoplasty. So now we have the dressing on. It's protecting the upper half of the ear. Some common questions. Can you shampoo your hair after otoplasty? Absolutely. Think about when you get your hair all sudsy in the shower. The parents are helping obviously with younger kids. Get a good soapy going with the shampoo, and then just with your pinkies or your fingers, you can get a little bit back in that crevice. Just letting the suds of the shampoo just kind of also keep the ears clean. It's okay for water to kind of trickle down there. There's no problem with that. And then this headband in general, you want to wear it about 24 hours a day, best you can, until you're 1 week from surgery. So 24 hours a day, best you can. Obviously you can take it off to shower and that sort of thing until you're 1 week post-surgery. And then you wear it just like this, nights only, until you're 1 month post-surgery. So 1 week post-surgery, 24/7, nights only until you're 30 days post-op.